The US healthcare system is quite problematic. Despite being the highest spender on healthcare, there is still many structural issues. Healthcare is still expensive, access to quality is uneven, and not having health insurance can lead to poor credit and bankruptcy. Much like other sectors of the economy that went through digitization, healthcare did the same. They digitized their medical records, stored these records on virtualized servers, and connected them all via the internet. This mass upgrade of healthcare IT systems brought about a lot of benefits, but now we're beginning to kind of experience some of the downsides. And an example of that is data theft by cybercriminals.
Breaches are increasing across the nation. Medical data breaches are increasing.
Medical systems in general are often receiving calls or letters from people who say they owe them money. Across the nation, experts say potential victims number in the millions.
Hi, I'm Michael. In this video, I'd like to explain to you why hospitals and medical facilities are prime targets for cybercriminals. I'll also highlight some of the major healthcare data breaches that happened in 2024. We'll discuss how data breaches can affect you as a person and outline some steps that you can do to protect yourself. Cybercriminals are attracted to healthcare facilities simply because these facilities store a lot of personal, private patient data. Think about it. You have to give your healthcare provider very personal information, like your social security number, full name, home address, email address, and phone numbers, dates of birth, medical records, including any diagnosis or medications that you're taking. And you also have to provide your insurance details, and maybe even more data. These pieces of information are incredibly valuable to you, and more importantly, very valuable to cybercriminals. Because cybercriminals can exploit this data for identity theft, insurance fraud, or a variety of other malicious activities, healthcare data is highly profitable, especially in the dark web. This financial incentive is a major reason why healthcare facilities are prime targets for cyber attacks. And which brings me to reason number 2. Because healthcare information is so sensitive and providers are legally obligated to protect patient confidentiality, these hospitals are often very willing to pay ransoms demanded by cybercriminals. As Ferdinand Hamada noted, the success of a ransomware attack is based on the probability that the targeted organization has the resources to pay the ransom, and healthcare industry generally checks this box. Healthcare providers are known to pay ransoms in order to regain control of their stolen or encrypted data. Stay tuned and I'll share some examples of this when we discuss 2 massive healthcare data breaches that happened this year. Compared to organizations such as financial institutions or technology companies, healthcare facilities are relatively easy for cybercriminals to break into. According to the HIPAA Journal, healthcare organizations typically have complex IT systems that are hard to secure. Many healthcare providers use outdated software solutions. And hospitals often have a bunch of connected devices with an average of 15 devices per hospital bed. Most of these devices were not developed with strong security in mind. Also, hospitals, they specialize in patient care and usually understaff the IT department, especially those that monitor security systems. In fact, a study from MediaPro shows that out of the 850 healthcare employees, 72% are considered security risks, and only 28% have the skills to recognize and avoid phishing attacks. Cybercriminals know that healthcare facilities fall short in security, and that's exactly what makes them prime targets. To sum it up, the 3 reasons why cybercriminals like targeting healthcare facilities are: 1, they store a lot of sensitive patient information. 2, healthcare organizations will likely pay a ransom. And 3, they have weak security. No wonder that this year alone there's been so many healthcare data breaches. In fact, we're going to talk about some of these next. The Kaiser data breach happened in mid-April this year and affected over 13 million customers. The breach is one of the largest healthcare data breaches of 2024. So here's what happened. An online tracking technology called web cookies was installed on Kaiser's websites and mobile apps. These web cookies allow patient data to be shared with third-party advertising giants like Google, Twitter, or Microsoft. Kaiser said that sensitive patient information like usernames, passwords, social security numbers, or even payment details were not compromised. However, the breach did impact patients' names, home addresses, email addresses, IP addresses, and also medical information. The breach also included information about whether a patient signed up for a Kaiser service and details about the activities on Kaiser's apps and websites. In a statement, Kaiser said that they're not aware of any misuse of any customer data or patient data. As we've discussed in our previous videos, even the most basic personal information can be used to dig up more information about you. So even if the sensitive data of Kaiser's members wasn't breached, they are still at risk. For now, Kaiser has removed the online tracking cookies. They have notified customers, and they are apparently boosting their cybersecurity measures to prevent a similar incident from happening in the future. In February of this year, a massive healthcare data breach exposed the data of 110 million Americans. The culprit was a cybercriminal gang known as Black Cat, and they took credit for targeting United Health Group and its subsidiary, Change Healthcare. Black Cat stole and used login credentials to access United Health's tech unit. This locked up Change Healthcare's system and essentially disrupted their entire operations for a week. Black Cat said they stole over 6 terabytes of data, including sensitive medical records, and they demanded ransom. United Health said they are still investigating the exact number of affected Americans and what data was stolen. And in other words, United Health is still in the dark about how much data was actually compromised. During a congressional hearing on May 1st, United Health CEO Andrew Whitty said,
and files in the exfiltrated data containing protected health information and personally identifiable information, which could cover a substantial proportion of people in America.
Also, Whitty said that they haven't verified whether full medical records are among the compromised data, and he also admitted that this breach happened because they didn't have multi-factor authentication. Can you believe it? A simple multi-factor authentication could have prevented all of this. And we've talked about this earlier. Cybercriminals do target healthcare because they have weak security systems. Aside from that, Whitty admitted that he gave the green light to pay hackers $22 million in ransom. He said it was part of their commitment to do all it could do to protect patient data.
General are often receiving calls or letters from people who say they owe them money across the nation.
This is just one example that shows how likely healthcare organizations are to pay ransom. There are even more cases where healthcare organizations do pay ransom. For example, in 2016, Presbyterian Medical Center paid hackers $17,000 in Bitcoin. The hospital said that paying was the quickest and most efficient way to restore our system and administrative functions. Unfortunately though, we don't know whether sensitive patient records are in the dark web, despite United Health paying the ransom. And what's to stop these hackers from later reselling this data in the future for even more money? This case is still developing, but United Health Group has set up a call center for affected customers, and they are offering free credit monitoring and identity protection for 2 years for anyone who's been affected. These two cases are just a glimpse of more than 100 reported healthcare data breaches that happened just in the first 3 months of this year alone. These number of breaches show how vulnerable the healthcare sector is and how unsafe your healthcare records can be. And no, just because healthcare facilities can pay ransom to get your data back does not mean that you're completely safe. Your healthcare information can be used for more than just ransom. For example, your healthcare information can be used for identity theft. This is exactly what happened in 2022. A medical assistant named Ashley Latimer, she stole and used information of female patients to commit identity fraud. Authorities said that Latimer took photos of forms and records containing patients' information, as well as driver's licenses. She then used all this personal information of 7 patients to open credit cards, rent an apartment, and lease a vehicle and make additional purchases of $31,000. Authorities believe there may have been more victims as Latimer worked at 3 different locations of Axia Women's Health and at the AFC Urgent Care in South Philadelphia. Eventually, though, Latimer was caught and charged with 27 counts of identity theft, 7 counts of theft, and 4 counts of computer theft, and 1 count of forgery. A slightly similar case also happened in Hollywood. In 2014, Yvette Tillman, who was working as a medical assistant at Gastroenterology Consultants, accessed the medical healthcare system database using her computer. She stole patient data like names, date of birth, social security numbers. She sold these stolen data of 2,000 patients for $50 each and kept a list of 114 different identities. Long story short, Tillman pleaded guilty to 1 count of possessing unauthorized access device with the intent to defraud and 1 count of aggravated identity theft. Aside from identity theft, your sensitive healthcare data can be used for blackmail. For example, in 2018, an American named Mickey Ferrara Broches blackmailed the Singaporean officials. In 2 emails, Broches claimed that he had data on the HIV status of 14,000 people in Singapore. His demands were to shut down the government-owned HIV database and release his imprisoned husband. The husband was Ler Taxian, a Singaporean doctor who was jailed in 2018 because of failing to protect the database that Broches accessed. Eventually, the FBI tracked and arrested Broches. During court hearings, Broches admitted that in 2012 he accessed the HIV database containing personal information of 5,400 Singaporeans and 8,800 foreigners. Broches was convicted on charges of sending threatening communications and possessing the identities of other people. Imagine that! What would you do if a cybercriminal blackmails you using a diagnosis that you have and not comfortable sharing with other people? Yes, it's very tragic. Bottom line is this. Your healthcare data is at risk of being compromised and it can be exploited not just for ransomware purposes but also for identity theft, blackmail, and more. But you have to know, it's not your fault that you have to provide your information to healthcare providers. Without that, you can't get service. The issue is that healthcare facilities just lack the best security system measures and cybercriminals are basically relentless. So it's becoming harder and harder to avoid becoming a victim of a healthcare data breach because they're happening so often. But the good news is, there are steps you can take if your data has been affected in a data breach. The first thing you can do is that you should freeze your credit so that your identity won't be used just like it was in Latimer's case. This process is free and easy to do. Just contact one of the credit bureaus, like Experian, Equifax, or TransUnion. The credit bureau that you contact will notify other credit bureaus about the fraud alert. You can also do this through their website. I'll put the link in the description below. Once your credit is frozen, fraudsters won't be able to open new credit accounts under your name or even access your credit report. And if your credit card company doesn't already do this, ask them to put an alert on your credit in case they detect any fraudulent activities that are not typical of your usual purchases. You can also ask them to cancel your compromised card and request a new card. Now, let's say that you found out that there were changes in your health information record, as an example. A scammer might have maxed out your medical benefits for a year or changed some, let's say, prescription information on your medical record. When that happens, you can ask your healthcare provider or medical insurer for corrections. First, make copies of the records and highlight the changes that should be corrected. Include a copy of a police report and identity theft report filed with the FTC. Next, send everything to your healthcare provider. Make sure to send your request via certified mail and ask for a return receipt so you can ensure that your provider received it. After that, the healthcare provider is legally required to make these corrections on your record and also alert other laboratories and other providers that may have received incorrect information about you. Setting up a safe code can help you prevent people who have your healthcare data from scamming your family or friends. Basically, you just have to decide on a safe code that you and your family members can use when there's a problem. It can be really any word. It could be a word like, let's say, burger. When a scammer calls pretending to be one of your loved ones and asking for money to buy meds or whatever other scam they have, you just ask a simple question. So, what do you want to eat for tomorrow? And if the scammer cannot give you that response of burger back, then it's a sign that obviously you're talking to an imposter. Because if it's a family member, they will know the code. If you think about it, it's kind of like the 6-digit code that your bank sends you before you have to log into your account or before you make like large transfers out of your account. It's an easy but highly effective way to prevent your information that's already out there from being used against you. Now, if you want to boost your privacy and prevent scammers from stealing your identity and scamming your family, you can also go to visit www.mydataremoval.com. There, you can run a free scan and see where your personal information is showing up online. You can also use our free opt-out guides to remove your information manually. All you have to do is just follow the steps and refer to the list of data brokers and people search sites that may hide your information. And if you don't want to spend the 40 to 100 hours to manually remove your data from hundreds of data broker sites, you can sign up to one of our services. We have plans that will automate the data removal process for you. Again, I want you to understand that this is not your fault. Your data is required for healthcare service. It's just that healthcare cybersecurity needs improvement and cybercriminals are just everywhere. Knowing that, you can focus on what you can do from becoming a victim from any of these healthcare data breaches. Remember the 5 things that we've covered on this video? 1, set up a fraud alert. 2, read your credit. 3, request corrections to your medical records. 4, set up a family safe code. And lastly, remove your information online using My Data Removal. So now you all know this information. What are your thoughts? Do you think healthcare providers should do more to protect our data? Do you have any suggestions for how we can make our data more secure and safe? Let us know in the comments. Also, please subscribe and stay tuned for more data-related privacy videos in the future. This has been My Data Removal. Our goal is to help you protect your most sensitive information, your data. Thank you, and see you on the next video.